Thank you. Well, in a nutshell, it means that, the work that our team in our nursing home has done is recognized, by AMDA, which is, I'm so humbled, but I feel like I am singled out for that award as a medical director, but it truly belongs to the team of people that I work with. And one of the things is that, if you are choosing to work in a nursing home, which is, by the way, the most exciting place in medicine that you could work in, the most complex work environment that you get. So if we are passionate about, practicing medicine in the most challenging field, arena, that's long-term care for you because, yes, it's great to have, be at the top of your medical, clinical skill set, but it is another thing to work that clinical set through a set of staff and rally them in giving excellence in patient care. And, I feel like we as a team give that. So really the award belongs to my team. That's number one. And I would be remiss if I don't talk about the mentors in AMDA who have, who really energize people like me to do better and better because we look up to them. We have looked up to so many people here who are so good at providing care and have such a good heart. And I have incredible mentors in AMDA. And due credit to them, that's what I think about. I think about my co-nominees and the great work that they are doing and, everyone else is doing in their facilities and making our residents, have the best quality of life and the best quality of care that they can receive. So a lot, but I'm excited to get the award, but I'm humbled as well because I know that I follow the giants. Yeah, so I would say that I thought that I was a great physician and, because I do like to be at the top of my clinical skill set. But, the role of medical director really kind of crystallized. And I've been working on a lot of initiatives in my nursing home. Let's get down the antipsychotics. We are much, much lower than the national level. We are much, much lower than the state level, obviously. But, that's because we created a team. I can't live with my consultant pharmacist. I can't live without my consultant pharmacist, rather. I can't live without my MDS coordinator. I can't live without my dietitian. That's who we need to take the care forward. So, I now realize, looking back, that I have we don't work in alone in a nursing home setting. We cannot. So as a medical director, we have the influence and the power to actually bring the expertise from the nursing, the rehab, the pharmacist, the activities, the MDS coordinators, the dietary, the kitchen folks, the EVS, and that has really been crystallized in the last 2 years. If you were going to be successful in keeping your patients safe, I can tell you that you didn't do it alone. We all did it together. Every single department in the nursing home came together, and that is the power that we have as the nurse, as the leader, clinical leader in a nursing home, as medical director, to rally everyone and to affect that change. And that is so incredibly powerful and so humbling at the same time, because we do have that. We do have that power of influence. And when you were able to, we had much, much higher numbers than the community. We had a 50-point differential in vaccination rate compared to the community that our staff lives in. And that was the change that we were able to affect because, they listened to me as a medical director because we were creating these teams. We had that relationship of trust. Our case numbers were much lower than, any other place in the community. Our staff did it. And I, as a clinical leader of the team, I had the power to influence, what was happening. And it's incredible. So I think we need to be able to hold that power and keep it sacred and understand how to, wield it and use it for the betterment of patient care. So I've been coming to AMDA meetings for a long time, and I did my fellowship, 2-year fellowship in geriatrics. Very proud of it. Very proud of the education that I received in my fellowship. By the way, a great fellowship program from UPMC in Pittsburgh. Shout out to my Pittsburgh people. And I thought that I knew a lot. And then I did my CMD course, Certified Medical Director course. And I found out what I didn't know. And it's a lot. And, again, it is, we have talked about how there are 2 things that you need to have, right? One is being at the top of your clinical skill set. And the second is how do you affect that and operationalize it in your nursing home by being the leader of the clinical team, by being the medical director. That I would assert is a completely different skill set. And doing the CMD curriculum actually allowed me to have access to that so that I was not trying to kind of stumble my way through it, but actually go in with confidence and know what is important to the nursing home. What are the things that get monitored? What are the tools that we have that we can use for the betterment for our patients? So, patient care, rather. And so, certainly there is that education, invaluable education that we get with, CMD course. And then I still remember my mentors. I mean, I've been walking these halls and stopping my faculty at the CMD. They're the ones who really inspired me to do well as medical director. So, there's that. And then I have a family, right? This feels like a family reunion. And I created a family when I came to the CMD course, and we are still in touch. So, so many different things you get, in the CMD course. So it's, first of all, I would encourage everyone who has any desire to work in a nursing home, whether you are going to be a medical director or you're not going to want to be a medical director, to understand the workings of a nursing home and the complexity of it. Do that, certified medical director course. So California is doing both things, right? The CMD and requiring that CMD course. And I think it's a great step in a positive direction. I hope my state takes it on and so many other states take it on because you kind of find out what you don't know, and then you're able to, affect a great positive change in the care setting. And as far as medical director registries is concerned, and I, again, shout out to California to kind of start that, and many other states are actually in the process of, taking it to their legislators. I can tell you that, when we started the COVID task force, when we knew, I knew that COVID was going to devastate the nursing home industry. I'd been following it from, when it started in Wuhan, and I'm like, it's going to come from Seattle because that's our trade route. And then it came to Kirkland, and I said, this is going to be devastating, and we need to get ahead of it. And We wrote our first guidance. I still remember in a corner of Starbucks, I was sitting finalizing that guidance, and it was February 28th, maybe 27th. If I had access to the medical director registry of all the nursing homes in the country, that is what I thought. I mean, right now we are putting these guidance out, but if I had access, wouldn't it be wonderful to take that guidance and make that knowledge accessible and make that awareness accessible to all the medical directors in all the nursing homes? And wouldn't we have had a lower toll on our elderly people who work in the nursing home? That's all I thought. And so, for making the knowledge that we have accessible to, to the bedsides of our elderly people who deserve the best care possible because they really have made this world what it is for us. We live in this world, we enjoy this world, but we need to understand it's the fruit of the labor of people who live in the nursing homes. And won't it be wonderful to provide that excellence of care by having accessibility to the knowledge that we do have in AMDA, to the articles, and how we can make care better in the nursing homes. From a perspective of somebody who was on the COVID task force, I wish I had that. And I know that that would have made a difference. I just want to say that, my husband was here and my children were here, for the award ceremony. And my husband is a cardiologist, and he belongs to different societies. He's, on medical societies. We belong to many different societies, and I can tell you what is unique about these AMDA meetings and AMDA is that, yes, it is all about excellence in care. Yes, there is great research and there is subject matter expertise, but what AMDA has is that easy mentorship. You can walk up to anybody in AMDA and say, I look up to you. And they will sit down with you, have a cup of coffee, and they will tell you how to succeed. And that is the unique quality of AMDA that, I wish that what I have had, it's like paying it forward. What I have had from the people around, I have picked up the phone and called them and I have said, I heard you here, can you help me? And people have helped me. I want to pay it forward. And I think once you join AMDA, you stay here because this is a family, so.